How to pass phlebotomy exam. Question 1. When disposing of a used venipuncture needle, which technique best supports OSHA bloodborne pathogen safety? Option A. Place the needle on the tray until the end of the patient visit. Option B. Recap the needle carefully before walking to the disposal area. Option C. Activate the safety device and place the needle directly into an approved sharps container. Option D. Break the needle from the syringe before discarding it. The correct answer is option C. Activate the safety device and place the needle directly into an approved sharps container. Needles should be disposed of immediately in puncture-resistant sharps containers after activating available safety features. Direct disposal reduces handling and minimizes the chance of percutaneous injury. Recapping, delaying disposal, or manipulating the needle increases exposure risk. Question 2. Before obtaining a manual blood pressure, which positioning step promotes the most accurate reading? Option A. Support the patient's arm at heart level with feet flat on the floor. Option B. Have the patient cross the legs to stabilize the body. Option C. Ask the patient to hold the arm in the air during the reading. Option D. Place the cuff over the antecubital space and inflate immediately. The correct answer is option A. Support the patient's arm at heart level with feet flat on the floor. Blood pressure technique requires proper posture, arm support, and cuff placement to reduce measurement error. Supporting the arm at heart level helps avoid falsely high or low readings. Unsupported arms, crossed legs, and incorrect cuff placement can distort the measurement. Question 3. While measuring respirations, which approach is most appropriate for an accurate respiratory rate? Option A. Record the respiratory rate from the previous visit if the patient seems stable. Option B. Tell the patient to breathe faster so the count is easier to measure. Option C. Observe chest rise and fall discreetly after assessing the pulse. Option D. Count respirations only when the patient is talking. The correct answer is option C. Observe chest rise and fall discreetly after assessing the pulse. Patients may alter breathing when they know respirations are being counted, so discreet observation improves accuracy. Counting chest rise and fall after pulse assessment is a common technique. Coaching the patient, counting during speech, or copying old data produces unreliable documentation. Question 4. According to standard precautions, which assumption should guide a medical assistant when handling blood and body fluid specimens? Option A. All blood and certain body fluids should be treated as potentially infectious. Option B. Gloves are unnecessary when the patient appears healthy and afebrile. Option C. Body fluids are infectious only when visible blood is present. Option D. Only specimens from patients with known infections require protective handling. The correct answer is option A. All blood and certain body fluids should be treated as potentially infectious. Standard precautions require healthcare workers to apply infection control practices to all patients regardless of diagnosis or appearance. Treating blood and certain body fluids as potentially infectious reduces occupational exposure risk. The other choices rely on assumptions about the patient or the specimen and can lead to unsafe practice. Question 5. Minutes after an injection, a patient develops wheezing, facial swelling, and hives. Which emergency is most likely? Option A. A delayed billing reaction. Option B. Mild seasonal allergies only. Option C. A routine vasovagal response without airway concern. Option D. Anaphylaxis. The correct answer is option D. They should be puncture-resistant and closable. Wheezing, facial swelling, and hives after medication exposure suggest anaphylaxis, a life-threatening allergic reaction. The medical assistant should activate emergency procedures and assist within scope. Mild allergies, vasovagal episodes, and billing issues do not match the airway and allergic findings. Question 6. Which site is appropriate for a dermal puncture on an infant's heel? Option A. The tip of the big toe near the nail bed. Option B. The medial or lateral plantar surface of the heel. Option C. The center of the heel directly over the calcaneus. Option D. The arch of the foot near the instep. The correct answer is option B. The medial or lateral plantar surface of the heel. Infant heel punctures are performed on the medial or lateral plantar surface to reduce risk of bone injury. The center of the heel may place the calcaneus at risk, and other foot areas are not recommended routine collection sites. Proper site selection is a key phlebotomy safety concept. Question 7. A patient collapses, is unresponsive, and is not breathing normally. What is the priority action? Option A, search the chart for insurance coverage before acting. Option B, activate emergency response and begin CPR if trained and indicated. Option C, give oral fluids to stimulate breathing. Option D, wait 10 minutes to see whether the patient wakes up. The correct answer is option B. Activate emergency response and begin CPR if trained and indicated. Unresponsiveness with absent or abnormal breathing requires immediate emergency activation and CPR by trained personnel. Early recognition and intervention are critical links in survival. Delaying for paperwork or giving fluids is unsafe and does not address cardiac or respiratory arrest. Question 8. When opening a sterile package, which action helps maintain the sterile field? Option A, touch the inside of the wrapper with bare hands to flatten it. Option B, reach across the field to open the far flap last. Option C, open the flap farthest from the body first and avoid reaching over the sterile contents. Option D, place the sterile field below waist level for convenience. The correct answer is option C. Open the flap farthest from the body first and avoid reaching over the sterile contents. Sterile technique requires preventing contamination of sterile contents and avoiding reaching over the field. Opening the far flap first helps keep the hands from crossing the sterile area. Low placement and bare hand contact with sterile surfaces break sterility. Question 9. A claim is denied because the subscriber identification number is invalid. Which action should be taken? Option A, bill a different patient with a similar name. Option B, verify the insurance information with the patient, correct the claim, and resubmit if appropriate. Option C, change the date of service to make the claim look newer. Option D, ignore the denial because payers correct all errors automatically. The correct answer is option B. Verify the insurance information with the patient, correct the claim, and resubmit if appropriate. Claim denials related to demographic or insurance errors should be researched and corrected using accurate information. Verification with the patient and payer records helps prevent repeat denials. Altering dates or billing another patient is improper and potentially fraudulent. Question 10. When documenting a patient's pain assessment, which entry is most complete? Option A, patient seems uncomfortable and probably has severe pain. Option B, patient pain appears unchanged from last visit. Option C, patient reports sharp lower abdominal pain rated 7 out of 10 that began this morning. Option D, pain is noted but the location is not important. The correct answer is option C. Patient reports sharp lower abdominal pain rated 7 out of 10 that began this morning. Pain documentation should include subjective patient report, location, quality, severity, and onset when available. A numeric rating scale supports consistent communication among healthcare team members. Guessing severity, omitting key descriptors, or relying on appearance alone weakens clinical documentation. Question 11. In preparation for a minor office procedure, who is responsible for explaining the risks, benefits, and alternatives needed for informed consent? Option A, the patient's insurance representative, because payment is involved. Option B, the receptionist, because scheduling created the appointment. Option C, the provider performing or ordering the procedure. Option D, the medical assistant independently, because consent forms are administrative documents. The correct answer is option C, the provider performing or ordering the procedure. Informed consent requires clinical explanation of the procedure, risks, benefits, and alternatives by the qualified provider. A medical assistant may witness a signature or verify completion according to policy but should not independently obtain clinical consent. Scheduling and insurance roles do not replace the provider's responsibility. Question 12. During venipuncture, how long should a tourniquet generally remain in place before it may affect specimen quality? Option A, no longer than 1 minute. Option B, until the patient reports numbness. Option C, for the entire time the patient is in the room. Option D, at least 5 minutes.
The correct answer is option B. Rotate stock so items with earlier expiration dates are used first.
Prolonged tourniquet application can cause hemoconcentration and alter certain laboratory values. A general rule is to release the tourniquet within 1 minute or as soon as blood flow is established according to policy. Leaving it on for several minutes or until symptoms occur is unsafe and can affect results. Question 13. Which action is most appropriate when a medical assistant receives a verbal order from a provider in an urgent situation? Option A, ignore the order because verbal communication is never used. Option B, repeat the order back for confirmation and document it according to policy. Option C, tell the patient to remember the order instead of charting it. Option D, change the order to what seems easier to perform. The correct answer is option B. Repeat the order back for confirmation and document it according to policy. Read back or repeat back helps confirm accuracy when verbal orders are permitted by policy. Proper documentation and authentication requirements protect patient safety and legal integrity. Altering, failing to document, or automatically ignoring permitted urgent orders can create errors. Question 14. After running an autoclave cycle, which indicator provides the strongest evidence that sterilization conditions were effective? Option A. A piece of autoclave tape that changed color on the outside of the pack. Option B. An operator note stating the autoclave door was closed during the cycle. Option C. A biological indicator showing that resistant spores were destroyed. Option D. A dry wrapper on the instrument pack after the cycle ended. The correct answer is option C. A biological indicator showing that resistant spores were destroyed. Biological indicators are the most definitive routine test of sterilization because they use highly resistant spores to verify microbial destruction. Chemical tape shows exposure to certain conditions but does not prove that all sterilization parameters were met. Dry packaging and operator notes are useful observations but are not equivalent to biological monitoring. Question 15. A patient has a bleeding forearm laceration in the office. Which first aid measure should be applied first? Option A. Apply direct pressure with appropriate protective equipment. Option B. Apply a tourniquet immediately for every minor cut. Option C. Hold the wound under hot water until bleeding stops. Option D. Remove any forming clots repeatedly to inspect the wound. The correct answer is option A. Apply direct pressure with appropriate protective equipment. Direct pressure is the initial first aid measure for most external bleeding and should be performed using standard precautions. It helps control bleeding while additional care is arranged. Repeated clot removal, hot water, or routine tourniquet use for minor wounds can worsen injury or be inappropriate. Question 16. A patient asks the medical assistant, "Do these lab results mean I have kidney disease?" Which response is within scope? Option A. Diagnose the condition based on the abnormal value. Option B. Tell the patient to stop taking all medications immediately. Option C. Explain that the provider will interpret the results and offer to relay the question promptly. Option D. Post the results in the waiting room for comparison with others. The correct answer is option C. Explain that the provider will interpret the results and offer to relay the question promptly. Medical assistants may collect data and communicate approved information, but diagnosis and interpretation belong to licensed providers. The appropriate response respects scope while ensuring the patient's concern reaches the provider. Diagnosing, giving independent medication orders, or breaching privacy is inappropriate. Question 17. After selecting a blood pressure cuff for an adult patient, which finding indicates the cuff size is appropriate? Option A. The cuff bladder covers only a small portion of the upper arm. Option B. The cuff is placed over thick clothing to improve patient comfort. Option C. The cuff is loose enough to slide down the forearm during inflation. Option D. The bladder encircles most of the upper arm and the cuff fits snugly at heart level. The correct answer is option D. The bladder encircles most of the upper arm and the cuff fits snugly at heart level. Accurate blood pressure measurement depends on using a properly sized cuff and positioning the arm at heart level. A cuff that is too small can overestimate the reading, while a loose or misplaced cuff can produce unreliable results. Clothing under the cuff interferes with sound transmission and compression. Question 18. A patient with limited English proficiency arrives with a minor child who offers to interpret. What is the best action? Option A. Use the child for all interpretation because it is convenient. Option B. Skip the history because communication will take too long. Option C. Speak louder in English until the patient nods. Option D. Arrange for a qualified medical interpreter according to facility policy. The correct answer is option D. Arrange for a qualified medical interpreter according to facility policy. Qualified medical interpreters improve accuracy, privacy, and informed communication. Minor children should not be used routinely for medical interpretation because of accuracy and ethical concerns. Skipping communication or speaking louder does not overcome language barriers. Question 19. Which patient should generally receive the earliest available urgent appointment or emergency direction based on office protocol? Option A. A patient reporting sudden facial drooping and arm weakness. Option B. A patient calling to update a mailing address. Option C. A patient asking for routine vaccine records. Option D. A patient requesting an annual wellness visit next month. The correct answer is option A. A patient reporting sudden facial drooping and arm weakness. Sudden facial drooping and arm weakness can indicate a stroke and require immediate escalation according to protocol. Scheduling decisions should prioritize potentially life-threatening symptoms. Routine wellness visits, record requests, and address updates do not require the same urgency. Question 20. Which organ produces insulin to help regulate blood glucose levels? Option A, pancreas. Option B, gallbladder. Option C, appendix. Option D, spleen.
The correct answer is option D. Schedule or provide instructions for the follow-up before the patient leaves when possible.
The pancreas contains endocrine cells that produce insulin, a hormone essential for glucose regulation. This concept is frequently tested because diabetes care is common in ambulatory settings. The spleen, gallbladder, and appendix do not have insulin production as their primary function. Question 21. A patient brings an advance directive to the office. What is the purpose of this document? Option A. To replace all consent forms for every future procedure. Option B. To communicate the patient's wishes for healthcare decisions if the patient cannot speak for themselves. Option C. To authorize the medical assistant to prescribe medication. Option D. To guarantee that insurance will pay every claim. The correct answer is option B. To communicate the patient's wishes for healthcare decisions if the patient cannot speak for themselves. Advance directives document patient preferences or decision-makers for future healthcare situations when capacity is impaired. They support patient autonomy and guide the healthcare team. They do not determine insurance payment, expand medical assistant scope, or eliminate procedure-specific consent requirements. Question 22. A patient asks for a copy of records to send to a new specialist. What should the medical assistant verify before release? Option A. That only verbal permission from a neighbor has been obtained. Option B. That the specialist personally calls the front desk without written details. Option C. That the release follows facility policy and any required authorization is complete. Option D. That the patient pays the full account balance before any records are released. The correct answer is option C. That the release follows facility policy and any required authorization is complete. Release of health information must follow legal and facility requirements, including valid authorization when required. Proper authorization identifies what information may be released, to whom, and for what purpose. Financial pressure, informal calls, or permission from unrelated individuals is not an appropriate basis for release. Question 23. When communicating with a patient who has hearing difficulty, which approach is most appropriate? Option A. Cover your mouth so the patient focuses on sound only. Option B. Assume the patient cannot participate in the conversation. Option C. Face the patient, speak clearly at a moderate pace, and reduce background noise. Option D. Shout from another room to make words louder. The correct answer is option C. Face the patient, speak clearly at a moderate pace, and reduce background noise. Patients with hearing difficulty often benefit from seeing the speaker's face and having background noise reduced. Clear speech at a moderate pace supports understanding without being disrespectful. Shouting, covering the mouth, or excluding the patient impairs communication. Question 24. Upon reviewing a patient's chart, the medical assistant sees the term bradycardia. What does this term mean? Option A. A normal rhythm with skipped documentation. Option B. Inflammation of a vein. Option C. An abnormally slow heart rate. Option D. An abnormally fast respiratory rate.
The correct answer is option A. Use the organization's approved secure communication system.
Bradycardia refers to a slower than expected heart rate for the patient's age and condition. Recognizing common prefixes such as Brady helps decode medical terms on exams and in charts. The distractors confuse cardiac rate with breathing, inflammation, or documentation status. Question 25. A patient slips in the hallway but states they feel fine. What should the medical assistant do? Option A. Notify the provider, assess according to role, document objective facts, and complete an incident report per policy. Option B. Place blame in the medical record before speaking with anyone. Option C. Ask the patient to sign a statement promising not to report it. Option D. Ignore the event because the patient denies injury. The correct answer is option A. Notify the provider, assess according to role, document objective facts, and complete an incident report per policy. Peak levels measure the highest expected drug concentration at a defined time after dosing. Trough timing, fasting, and clotted capillary collection do not describe standard peak level timing. Question 26. Which action is best when a patient asks why a test was ordered? Option A. Refer the patient to the provider for interpretation of the reason. Option B. Guess based on the diagnosis listed. Option C. Tell the patient the result will probably be abnormal. Option D. Refuse to answer and walk away. The correct answer is option A. Refer the patient to the provider for interpretation of the reason. The provider is responsible for explaining diagnostic reasoning and interpreting medical necessity. Guessing, predicting abnormal results, or being dismissive can misinform the patient and undermine professionalism. Question 27. Why should a phlebotomist avoid drawing above an active 4 when possible? Option A. The vein will always collapse above an 4. Option B. 4 fluid can dilute or contaminate the specimen. Option C. Tourniquets cannot be used on arms with IVs. Option D. Blood cannot flow above an 4 site. The correct answer is option B. 4 fluid can dilute or contaminate the specimen. 4 fluids can alter test results if the specimen is collected from an area affected by infusion. Vein collapse is not guaranteed, blood flow still occurs, and tourniquet use depends on facility policy and patient condition. Question 28. Which tube is commonly used for ESR testing by the Westergren method in many settings? Option A. Orange top tube. Option B. Pink top tube. Option C. Black top tube. Option D. Gray top tube. The correct answer is option C. Black top tube. Black top tubes contain sodium citrate for erythrocyte sedimentation rate testing in many collection systems. Gray, orange, and pink tubes are associated with different additives or testing purposes. Question 29. On a certification-style scenario, which PPE is most commonly required for routine venipuncture? Option A. Shoe covers. Option B. Face shield for every draw. Option C. Sterile gown. Option D. Gloves. The correct answer is option D. Gloves. Gloves provide a basic barrier against blood exposure during routine blood collection. Sterile gowns, face shields, and shoe covers may be needed for specific risks but are not the standard minimum for every routine draw. Question 30. Which tube additive prevents clotting by binding calcium for coagulation studies? Option A. Sodium citrate. Option B. EDTA for hematology only. Option C. Thrombin. Option D. Sodium fluoride only. The correct answer is option A. Sodium citrate. Sodium citrate binds calcium reversibly and preserves the specimen for coagulation testing when the tube is properly filled. EDTA is not used for routine coagulation testing. Thrombin promotes clotting, and fluoride is mainly used to inhibit glycolysis. Question 31. Which specimen is most likely to be rejected by the laboratory? Option A. Properly labeled tube collected at bedside. Option B. Unlabeled tube. Option C. Specimen transported according to policy. Option D. Additive tube gently inverted after collection. The correct answer is option B. Unlabeled tube. An unlabeled specimen cannot be reliably linked to the patient and is commonly rejected. Correct labeling, mixing, and transport support specimen acceptability rather than rejection. Question 32. Which tube is commonly associated with blood bank testing such as type and screen? Option A. Light blue citrate tube. Option B. Green top heparin tube. Option C. Pink top EDTA tube. Option D. Gray top fluoride tube. The correct answer is option C. Pink top EDTA tube. Pink EDTA tubes are commonly used for blood bank testing because they preserve cells for compatibility-related testing. Fluoride, citrate, and heparin tubes are used for other laboratory purposes and are not the standard blood bank tube choice in many systems. Question 33. Which action is required when collecting a blood culture set? Option A. Touch the bottle tops after disinfection to confirm dryness. Option B. Collect after all additive tubes are filled. Option C. Use only a lavender tube for both aerobic and anaerobic testing. Option D. Use aseptic technique and follow bottle volume requirements. The correct answer is option D. Use aseptic technique and follow bottle volume requirements. Blood culture accuracy depends on aseptic collection and proper blood volume in the correct bottles. Lavender tubes, late collection, and touching disinfected tops can cause contamination or invalid culture collection. Question 34. Which action helps prevent needle stick injuries after venipuncture? Option A. Activate the safety device immediately and discard the needle in a sharps container. Option B. Carry the used needle to the desk for later disposal. Option C. Recap the needle using 2 hands. Option D. Place the needle on the tray while labeling tubes. The correct answer is option A. Activate the safety device immediately and discard the needle in a sharps container. Immediate safety activation and sharps disposal reduce exposure risk after collection. Carrying, recapping, or setting down used needles creates preventable injury hazards. Question 35. Which vein is often considered higher risk because it lies near nerves in the brachial artery? Option A. Median cubital vein. Option B. Basilic vein. Option C. Cephalic vein. Option D. Dorsal metacarpal vein. The correct answer is option B. Basilic vein. The basilic area is used with caution because important nerves and arteries are nearby. Median cubital, dorsal hand, and cephalic sites may still require care but are not the classic highest-risk antecubital choice. Question 36. On a certification-style scenario, which specimen issue can be caused by leaving a tourniquet on too long? Option A. Sterile contamination. Option B. Loss of tube vacuum. Option C. Hemoconcentration. Option D. Hemodilution from fluid only. The correct answer is option C. Hemoconcentration. Prolonged tourniquet pressure can concentrate blood components and alter certain test values. For dilution, microbial contamination, and tube vacuum loss have different causes. Question 37. Which action is correct if a patient asks for test results during collection? Option A. Promise the result will be normal. Option B. Give results from another patient's chart as an example. Option C. Tell the patient the expected result based on appearance of blood. Option D. Explain that results must be obtained from the provider or authorized reporting process. The correct answer is option D. Explain that results must be obtained from the provider or authorized reporting process. Phlebotomists generally do not interpret or release results outside approved procedures. Guessing, sharing another chart, or promising results is inaccurate and may violate privacy or professional boundaries. Question 38. Which angle is commonly appropriate for routine antecubital venipuncture? Option A. About 15 to 30 degrees. Option B. About 60 to 90 degrees. Option C. A flat against the skin at 0 degrees. Option D. Straight downward at 90 degrees for all patients. The correct answer is option A. About 15 to 30 degrees. A 15 to 30 degree angle is commonly used to enter a superficial antecubital vein safely. Steeper or flat angles can miss the vein, pass through it, or increase tissue trauma. Question 39. Which action is appropriate when a hematoma begins to form during venipuncture? Option A. Continue drawing because the tube is nearly full. Option B. Release the tourniquet, remove the needle, and apply pressure. Option C. Insert the needle deeper through the swelling. Option D. Massage the swelling to disperse the blood. The correct answer is option B. Release the tourniquet, remove the needle, and apply pressure. A forming hematoma indicates blood is leaking into tissue, so the draw should stop and pressure should be applied. Continuing, massaging, or probing can worsen tissue injury and patient discomfort. Question 40. Which action is most appropriate if a patient does not speak the phlebotomist's language? Option A. Ask a child in the room to interpret medical information. Option B. Proceed without explanation if the order is clear. Option C. Use an approved interpreter according to policy. Option D. Speak louder until the patient nods. The correct answer is option C. Use an approved interpreter according to policy. Approved interpreters support accurate communication and informed cooperation. speaking louder, using children, or skipping explanation can create misunderstandings and ethical concerns. Question 41. Which action helps produce a better capillary specimen without hemolysis? Option A. Use a cold site to slow blood flow. Option B. Scrape blood from the skin surface repeatedly. Option C. Squeeze the puncture site forcefully. Option D. Warm the site when appropriate and allow blood to flow freely. The correct answer is option D. Warm the site when appropriate and allow blood to flow freely. Warming improves blood flow and reduces the need for excessive pressure that can damage cells or dilute the sample. Forceful squeezing, scraping, and using a cold site can lead to hemolysis, clotting, or poor specimen quality. Question 42. Which action is best when a patient has a seizure during collection? Option A. Remove the needle if possible and protect the patient from injury while calling for help. Option B. Hold the patient down forcefully. Option C. Place an object in the patient's mouth. Option D. Continue collecting because movement will stop soon. The correct answer is option A. Remove the needle if possible and protect the patient from injury while calling for help. During a seizure, preventing injury and getting help are priorities, and the needle should be removed when safe. Forceful restraint, putting objects in the mouth, or continuing the draw can cause serious harm. Question 43. On a certification-style scenario, which factor can cause a falsely low glucose result if processing is delayed? Option A. Excessive patient hydration only. Option B. Glycolysis by blood cells. Option C. Labeling the tube at bedside. Option D. Using a tourniquet for less than 1 minute. The correct answer is option B. Glycolysis by blood cells. Cells continue using glucose after collection, so delayed processing can lower measured glucose unless preserved appropriately. Hydration, proper tourniquet timing, and bedside labeling are not the main cause of delayed glucose decline. Question 44. Which step is part of verifying a laboratory requisition? Option A. Collect extra tubes for any possible test. Option B. Use only the patient's room number to match the order. Option C. Confirm the ordered tests and patient identifiers match the patient. Option D. Ignore the requisition if tubes are already available. The correct answer is option C. Confirm the ordered tests and patient identifiers match the patient. Reviewing the requisition helps ensure the right patient, tests, and collection requirements are followed. Ignoring orders, collecting unnecessary specimens, or relying on room number alone increases errors. Question 45. Which post-puncture instruction is most important after an accidental arterial puncture? Option A. Send the patient away without observation. Option B. Ask the patient to bend the arm sharply. Option C. Apply a loose bandage only. Option D. Apply firm pressure for a longer period and report according to policy. The correct answer is option D. Apply firm pressure for a longer period and report according to policy. Arterial puncture can bleed more significantly, so firm prolonged pressure and proper reporting are necessary. Loose bandaging, arm bending, or no observation can increase bleeding and complication risk. Question 46. Which information should the phlebotomist verify before a timed medication level? Option A. Dose time and ordered collection time. Option B. Patient's preferred breakfast food. Option C. Insurance authorization number. Option D. The color of the collection chair. The correct answer is option A. Dose time and ordered collection time. Medication level interpretation depends on accurate relationship between dose timing and specimen timing. Food preference, insurance details, and chair color do not establish correct timing for drug monitoring. Question 47. Which step helps prevent hemolysis during specimen collection? Option A. Shake tubes vigorously after collection. Option B. Use a properly sized needle and gentle tube handling. Option C. Force blood from a syringe through the needle into a tube. Option D. Draw through a hematoma to access blood faster. The correct answer is option B. Use a properly sized needle and gentle tube handling. Proper needle size and gentle inversions reduce red blood cell damage during and after collection. Vigorous shaking, drawing through compromised tissue, and forcing blood through a needle can rupture cells and cause hemolysis. Question 48. Which order of draw sequence is most appropriate for routine venipuncture? Option A. Gray, lavender, serum, blood cultures, light blue, green. Option B, serum, blood cultures, lavender, light blue, gray, green. Option C, blood cultures, light blue, serum, green, lavender, gray. Option D, lavender, gray, green, serum, light blue, blood cultures. The correct answer is option C, blood cultures, light blue, serum, green, lavender, gray. The standard order of draw is designed to reduce additive carryover and protect test accuracy. Collecting EDTA, fluoride, or serum tubes out of sequence can contaminate later specimens and alter results. Question 49. Which specimen is most likely to require chain of custody documentation? Option A, basic metabolic panel. Option B, complete blood count. Option C, routine cholesterol screening. Option D, legal blood alcohol test. The correct answer is option D, legal blood alcohol test. Chain of custody documents specimen handling when results may be used in legal or forensic settings. Routine chemistry and hematology tests require accurate labeling but usually do not require legal chain of custody tracking. Question 50. On a certification-style scenario, which test may require a trough specimen? Option A, therapeutic drug monitoring. Option B, routine blood typing. Option C, standard CBC without medication monitoring. Option D, a random cholesterol screening. The correct answer is option A, therapeutic drug monitoring. Trough levels are collected just before the next dose to evaluate the lowest drug concentration. Blood typing, CBC, and random cholesterol testing are not typically timed as medication troughs. Question 51. Which type of specimen should be mixed by gentle inversion immediately after collection? Option A, non-additive serum tube only. Option B, anticoagulant tube specimen. Option C, Sharps container contents. Option D, a blood culture bottle after incubation. The correct answer is option B, anticoagulant tube specimen. Anticoagulant tubes must be mixed promptly so blood contacts the additive evenly. Non-additive serum tubes clot instead. Blood culture handling follows bottle instructions, and Sharps containers are not mixed. Question 52. Which color tube is commonly used for glucose testing because it contains an antiglycolytic additive? Option A, yellow SBS top. Option B, tan top. Option C, gray top. Option D, royal blue top. The correct answer is option C, gray top. Gray tubes commonly contain sodium fluoride with an anticoagulant to help preserve glucose by slowing glycolysis. Royal blue, SBS yellow, and tan tubes serve different specialized testing purposes. Question 53. A fasting glucose specimen is ordered. Which patient statement requires follow-up before collection? Option A. My provider told me to fast for the test. Option B. I only had water before coming in. Option C. I have not eaten since last night. Option D. I drank sweetened coffee this morning. The correct answer is option D. I drank sweetened coffee this morning. Sweetened coffee can affect glucose results and may mean the fasting requirement was not met. Not eating, drinking water only, and following provider fasting instructions are consistent with typical fasting collection requirements. Question 54. A patient begins to feel faint during venipuncture. Which action should the phlebotomist take first? Option A, remove the needle and protect the patient from injury. Option B, finish filling the tube quickly. Option C, ask the patient to stand and walk slowly. Option D, leave the needle in place while calling the provider. The correct answer is option A, remove the needle and protect the patient from injury. Safety is the priority when syncope occurs, so the needle should be removed and the patient protected from falling or injury. Continuing the draw, making the patient stand, or leaving the needle in place increases the risk of harm. Question 55. Which situation is an example of an acceptable reason to recollect a specimen? Option A. The label was written neatly. Option B. The tube is clotted when an anticoagulated specimen is required. Option C. The tube was inverted according to instructions. Option D. The specimen was collected from the correct patient. The correct answer is option B. The tube is clotted when an anticoagulated specimen is required. A clotted anticoagulated specimen may be unsuitable because the test requires unclotted blood. Neat labeling, correct patient collection, and proper mixing are acceptable practices and do not require recollection. Question 56. Which action is correct when using a lancet for capillary puncture? Option A, puncture parallel to fingerprint lines on an adult finger. Option B, choose the thumb as the preferred finger stick site. Option C, use a puncture device appropriate for the patient's age and site. Option D, reuse the lancet for the same patient if more blood is needed. The correct answer is option C. Use a puncture device appropriate for the patient's age and site. Lancets must match patient age and puncture site to reduce injury and obtain an adequate specimen. Lancets are single-use, adult finger punctures are usually across fingerprint lines, and the thumb is generally avoided. Question 57. On a certification-style scenario, which documentation is most important when a specimen is collected late for a timed test? Option A, the patient's room temperature. Option B, the brand of gloves used. Option C, the phlebotomist's lunch time. Option D, actual collection time. The correct answer is option D, actual collection time. Timed test interpretation depends on the actual collection time, so it must be documented accurately. Personal schedules, glove brands, and room temperature are not the key timing information for most timed blood tests. Question 58. Which action is required immediately after filling an additive tube? Option A, gently invert the tube the recommended number of times. Option B, place the tube upright without mixing. Option C, shake the tube until bubbles appear. Option D, remove the stopper to release pressure. The correct answer is option A, gently invert the tube the recommended number of times. Gentle inversion mixes blood with the additive to prevent clotting or preserve the specimen as intended. Not mixing can cause clots, shaking can damage cells, and removing the stopper can expose the specimen and increase contamination risk. Question 59. Which department commonly performs a complete blood count? Option A, microbiology. Option B, hematology. Option C, histology. Option D, immunohematology only. The correct answer is option B, hematology. CBC testing evaluates blood cells and is performed in hematology. Microbiology focuses on organisms, immunohematology focuses on blood bank testing, and histology studies tissues. Question 60. Which patient position is safest for a person with a history of fainting during blood draws? Option A, sitting on a rolling stool without arm support. Option B, walking slowly during collection. Option C, lying down or seated in a secure reclining chair. Option D, standing beside the collection chair. The correct answer is option C, lying down or seated in a secure reclining chair. A reclined or secure seated position reduces injury risk if syncope occurs. Standing, unsupported sitting, or moving during collection increases fall and needle injury risk. Question 61. Which patient interaction shows respect for cultural differences? Option A, use family members for interpretation in every situation. Option B, ignore religious or modesty concerns during collection. Option C, assume all patients from one culture want the same approach. Option D, ask open-ended questions about preferences that may affect care. The correct answer is option D, ask open-ended questions about preferences that may affect care. Open-ended questions help identify individual preferences without stereotyping. Assumptions, ignoring concerns, and relying automatically on family interpreters can compromise respectful and accurate care. Question 62. Which capillary collection site is generally appropriate for an infant younger than 1 year? Option A, medial or lateral plantar surface of the heel. Option B, center of the infant's heel. Option C, finger pad of the index finger. Option D, arch of the foot. The correct answer is option A, medial or lateral plantar surface of the heel. The medial or lateral plantar heel surface helps avoid injury to bone and nerves in infants. The center heel, index finger, and arch increase risk of tissue, bone, or nerve injury. Question 63. Which patient condition may make capillary puncture preferable to venipuncture? Option A, an order requiring multiple large volume tubes. Option B, very small or difficult veins when only a small sample is needed. Option C, coagulation testing needing a full citrate tube. Option D, a blood culture collection requiring strict volume. The correct answer is option B, very small or difficult veins when only a small sample is needed. Capillary puncture can be useful when only a small specimen is needed and venous access is difficult. Large volume testing, blood cultures, and full citrate coagulation specimens generally require venipuncture or specific collection methods. Question 64. On a certification-style scenario, which specimen is likely compromised if a serum tube is centrifuged before clotting is complete? Option A, blood culture bottle. Option B, light blue coagulation specimen. Option C, serum chemistry specimen. Option D, whole blood CBC specimen. The correct answer is option C, serum chemistry specimen. Serum tubes must clot before centrifugation to prevent fibrin formation and poor specimen quality. CBC, blood culture, and coagulation specimens are handled according to different anticoagulated or culture-specific requirements. Question 65. Which collection error can cause a blood culture contamination false positive? Option A, transporting bottles promptly. Option B, collecting cultures before additive tubes. Option C, using the correct bottle volume. Option D, poor skin antisepsis before collection. The correct answer is option D, poor skin antisepsis before collection. Poor antisepsis allows skin organisms to enter the culture bottle and grow falsely. Correct volume, proper order, and prompt transport help culture quality rather than causing contamination. Question 66. A lavender top tube is drawn before a potassium chemistry tube by mistake. Which problem may occur? Option A, falsely elevated potassium from EDTA carryover. Option B, falsely decreased glucose from citrate carryover. Option C, contaminated blood culture bottles from serum gel. Option D, delayed clot formation from sodium fluoride. The correct answer is option A, falsely elevated potassium from EDTA carryover. EDTA contains potassium salts in many tubes, so carryover can falsely increase potassium results in chemistry testing. Citrate, serum gel, and fluoride are not the main concern in this specific sequence error. Question 67. Which action best reduces the risk of specimen mislabeling? Option A, label tubes before entering the patient room. Option B, label the tube at the patient's side immediately after collection. Option C, ask a coworker to label tubes later from memory. Option D, take unlabeled tubes to the lab for batch labeling. The correct answer is option B, label the tube at the patient's side immediately after collection. Bedside labeling immediately after collection links the specimen to the correct patient and collection event. Prelabeling, delayed labeling, and memory-based labeling increase the chance of wrong patient errors. Question 68. Which site should generally be avoided for venipuncture? Option A, a hand vein when antecubital veins are unavailable. Option B, the opposite arm from and for when accessible. Option C, an arm with a dialysis fistula unless specifically approved. Option D, the median cubital vein on a suitable arm. The correct answer is option C, an arm with a dialysis fistula unless specifically approved. A dialysis fistula arm should be protected because puncture can damage access and increase complications. Suitable antecubital, hand, or opposite arm sites may be used when appropriate and permitted by policy. Question 69. During outpatient registration, which action best confirms a patient's identity before venipuncture? Option A, compare only the patient's first name with the requisition. Option B, ask a family member to point to the patient. Option C, use the room number listed on the schedule. Option D, ask the patient to state their full name and date of birth. The correct answer is option D, ask the patient to state their full name and date of birth. Active identification using two identifiers reduces wrong patient collection errors before blood is drawn. Room numbers, family confirmation, and first name matching are not reliable because they can be inaccurate or shared by more than one patient. Question 70. Which action is best if blood flow stops during an evacuated tube draw? Option A, check needle position gently and try a new tube if needed. Option B, probe deeply in multiple directions. Option C, remove the stopper and pour blood into the tube. Option D, ask the patient to bend the arm tightly. The correct answer is option A, check needle position gently and try a new tube if needed. Loss of flow can result from needle position or tube vacuum failure, and gentle correction or a new tube may resolve it. Deep probing, pouring blood, or bending the arm can injure the patient or compromise the specimen. Question 71. On a certification-style scenario, a patient refuses a blood draw after the test is explained. Which response is most appropriate? Option A. Force the draw because the order is in the chart. Option B. Respect the refusal and notify the appropriate healthcare professional. Option C. Document that the patient was unavailable without reporting the refusal. Option D. Ask another patient to convince them. The correct answer is option B. Respect the refusal and notify the appropriate healthcare professional. Patients have the right to refuse procedures, and the refusal should be documented and communicated according to policy. Forcing a draw, relying on another patient, or misdocumenting the situation is unethical and unsafe. Question 72. Which action is appropriate if a patient has had a mastectomy on one side? Option A. Ignore the history if veins are visible. Option B. Apply a tourniquet tightly over the surgical side. Option C. Follow facility policy and avoid the affected side unless approved. Option D. Always draw from the affected side first. The correct answer is option C. Follow facility policy and avoid the affected side unless approved. Mastectomy history can affect lymphatic drainage and infection risk, so site selection should follow policy and provider guidance. Automatically using the affected side, ignoring history, or applying tight pressure there may increase complications. Question 73. A phlebotomist cleans a venipuncture site for a blood culture. Which practice is most appropriate? Option A. Wipe the site dry with clean gauze immediately. Option B. Palpate the vein again without sterile technique. Option C. Blow gently on the site to speed drying. Option D. Allow the antiseptic to air dry completely. The correct answer is option D. Allow the antiseptic to air dry completely. Antiseptic must air dry so it can work effectively and so skin organisms are less likely to contaminate the specimen. Blowing, repalpating without proper technique, or wiping away the antiseptic can reintroduce microorganisms and compromise the culture. Question 74. Which patient is most likely to require extra care for fragile veins? Option A. An older adult with thin skin. Option B. A healthy adult athlete. Option C. A young adult with no medical history. Option D. A patient drinking water in the waiting area. The correct answer is option A. An older adult with thin skin. Older adults may have fragile veins in skin, requiring careful site selection and gentle technique. Athletic, young, or hydrated patients may still require proper care but are not the classic fragile vein risk group. Question 75. Which area is inappropriate for adult fingerstick collection? Option A. The side of the middle finger pad. Option B. The very tip or center of the finger pad. Option C. A warm well-perfused puncture site. Option D. The side of the ring finger pad. The correct answer is option B. The very tip or center of the finger pad. The very tip or center can be more painful and may be closer to bone or nerve endings. The side of the middle or ring finger pad is commonly preferred when warm and well perfused. Question 76. Which action is most appropriate for a patient with needle anxiety? Option A. Show the needle repeatedly to prepare them. Option B. Rush the draw without speaking. Option C. Use calm communication and explain each step briefly. Option D. Tell the patient there is no reason to be afraid. The correct answer is option C. Use calm communication and explain each step briefly. Calm explanation and respectful communication can reduce anxiety and improve cooperation. Dismissing fear, repeatedly showing the needle, or rushing may increase distress and reduce trust. Question 77. Which professional behavior is appropriate when entering a patient's room? Option A. Ignore patient questions to save time. Option B. Discuss another patient's results with the patient. Option C. Begin setting up without speaking. Option D. Introduce yourself and explain the procedure briefly. The correct answer is option D. Introduce yourself and explain the procedure briefly. A clear introduction and brief explanation support patient trust, cooperation, and informed participation. Silence, unrelated patient information, and ignoring questions are unprofessional and may violate privacy or communication standards. Question 78. On a certification-style scenario, which information must be included on a properly labeled blood specimen? Option A. Patient identifiers, collection date and time, and collector identification. Option B. Patient diagnosis and insurance number only. Option C. Room number and provider's initials only. Option D. Test price and billing code only. The correct answer is option A. Patient identifiers, collection date and time, and collector identification. Specimen labels must support accurate identification and traceability from collection through testing. Diagnosis, insurance, room number, pricing, or billing codes do not replace required patient and collection identifiers. Question 79. A phlebotomist accidentally touches a cleaned venipuncture site before inserting the needle. Which action is best? Option A, proceed because gloves are clean. Option B, clean the site again before proceeding. Option C, cover the touched area with tape. Option D, blow on the site and continue. The correct answer is option B. Clean the site again before proceeding. Touching the prepared site can contaminate it, so the area should be cleansed again. Clean gloves are not sterile, blowing adds contamination, and tape does not disinfect the site. Question 80. Which specimen type is most appropriate for many point-of-care glucose tests? Option A, sputum specimen. Option B, CSF specimen. Option C, capillary whole blood. Option D, clotted serum only. The correct answer is option C, capillary whole blood. Point-of-care glucose testing commonly uses capillary whole blood obtained by fingerstick. Serum, sputum, and cerebrospinal fluid are not the usual specimen types for routine bedside glucose meter testing. Question 81. After a needle stick injury, which action should the phlebotomist take first? Option A, recap the needle and place it in a pocket. Option B, apply a bandage and ignore the incident if there is no bleeding. Option C, finish all remaining patient draws first. Option D, wash the area and report the exposure immediately. The correct answer is option D, wash the area and report the exposure immediately. Immediate cleansing and reporting allow timely exposure evaluation and follow-up. Delaying reporting, ignoring the injury, or recapping and pocketing a needle increases risk and violates safety practice. Question 82. Which tube is commonly used for plasma chemistry testing when heparin is the additive? Option A, green top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, gray top tube. The correct answer is option A, green top tube. Green top tubes commonly contain heparin and are used for many plasma chemistry tests. Lavender contains EDTA, light blue contains citrate, and gray contains fluoride with an anticoagulant. Question 83. Which test commonly requires protection from light after collection? Option A, sodium. Option B, bilirubin. Option C, blood urea nitrogen. Option D, chloride. The correct answer is option B, bilirubin. Bilirubin is light sensitive, so specimens are commonly protected to prevent analyte degradation. Sodium, chloride, and bun are not the classic routine examples requiring light protection after collection. Question 84. Which statement best describes standard precautions? Option A, apply precautions only for patients with known infections. Option B, skip hand hygiene if gloves were worn. Option C, treat all blood and certain body fluids as potentially infectious. Option D, use gloves only when a patient appears ill. The correct answer is option C, treat all blood and certain body fluids as potentially infectious. Standard precautions assume potential infectious risk for blood and certain body fluids from every patient. Visible illness, known infection status, and glove use do not replace consistent precautions and hand hygiene. Question 85. On a certification-style scenario, which statement about tube expiration dates is accurate? Option A, expired tubes can be used if the patient is fasting. Option B, expiration dates matter only for blood culture bottles. Option C, expired tubes are safe if the stopper looks clean. Option D, expired tubes may have reduced vacuum or additive problems and should not be used. The correct answer is option D. Expired tubes may have reduced vacuum or additive problems and should not be used. Tube expiration affects vacuum and additive reliability, which can compromise fill volume and specimen integrity. Visual cleanliness, culture-only assumptions, and fasting status do not make expired tubes acceptable. Question 86. Which condition makes a specimen more likely to be hemolyzed? Option A, using a needle that is too small for the collection. Option B, allowing antiseptic to dry fully. Option C, gently inverting additive tubes. Option D, releasing the tourniquet on time. The correct answer is option A, Using a needle that is too small for the collection. A very small needle can create shear stress that damages red blood cells during collection. Dry antiseptic, gentle inversion, and timely tourniquet release support proper collection technique. Question 87. Which practice best supports HIPAA compliance in a phlebotomy area? Option A. Call out full diagnoses in the waiting room. Option B. Discuss patient information only with authorized personnel. Option C. Share lab results with a visitor who asks politely. Option D. Leave requisitions face up on a public counter. The correct answer is option B. Discuss patient information only with authorized personnel. HIPAA requires limiting protected health information to authorized use and disclosure. Public discussion, exposed paperwork, and sharing results with unauthorized visitors can violate confidentiality. Question 88. Which action is correct when collecting from a patient in isolation? Option A. Take extra supplies into the room and return unused items to the cart. Option B. Remove PPE in the hallway before leaving the room. Option C. Follow posted precautions and use required PPE before entering. Option D. Enter quickly without PPE if the draw is brief. The correct answer is option C. Follow posted precautions and use required PPE before entering. Isolation procedures protect the patient, staff, and environment from transmission. Skipping PPE, returning potentially contaminated supplies, or removing PPE in the wrong area can spread contamination. Question 89. Why should patients avoid pumping the fist repeatedly during venipuncture? Option A. It replaces the need for a tourniquet. Option B. It prevents blood from entering the tube. Option C. It sterilizes the puncture site too quickly. Option D. It can alter some analyte levels such as potassium. The correct answer is option D. It can alter some analyte levels such as potassium. Repeated fist pumping can cause local changes that affect certain laboratory values. It does not sterilize the skin, stop blood flow into tubes, or eliminate the need for proper vein access technique. Question 90. Which action should occur after the last tube is filled but before needle removal? Option A. Release the tourniquet. Option B. Ask the patient to stand. Option C. Label the tubes away from the patient. Option D. Dispose of the tube holder in regular trash. The correct answer is option A. Release the tourniquet. Releasing the tourniquet before needle removal reduces pressure and helps limit bleeding or hematoma formation. Standing, delayed labeling, and improper disposal are not appropriate steps at that point. Question 91. Which specimen should be transported at body temperature when required by protocol? Option A. Routine CBC specimen. Option B. Cold agglutinin specimen. Option C. Urine pregnancy test specimen. Option D. Standard serum sodium specimen. The correct answer is option B. Cold agglutinin specimen. Cold agglutinin specimens may require warmth to prevent temperature-related changes before testing. Routine CBC, sodium, and urine pregnancy specimens do not typically require body temperature transport. Question 92. On a certification-style scenario, which action is safest when selecting a venipuncture site near a nerve complaint? Option A. Redirect the needle toward the pain. Option B. Ask the patient to ignore tingling until the tube fills. Option C. Stop and choose another suitable site if the patient reports sharp radiating pain. Option D. Continue because nerve pain is expected. The correct answer is option C. Stop and choose another suitable site if the patient reports sharp radiating pain. Sharp radiating pain may indicate nerve contact, so the attempt should stop to prevent injury. Continuing, redirecting toward pain, or dismissing tingling can worsen nerve trauma. Question 93. Which action is most appropriate when the requisition and patient ID band do not match? Option A. Ask the roommate to confirm the patient's name. Option B. Use the requisition because it came from the provider. Option C. Collect the specimen and correct the label later. Option D is stop and resolve the discrepancy before collecting. The correct answer is option D. Stop and resolve the discrepancy before collecting. Discrepant identifiers must be resolved before collection to prevent wrong patient testing. Collecting first, choosing one source, or relying on a roommate creates serious identification risk. Question 94. Which action is correct when transporting specimens in a facility? Option A, place specimens in approved leak-resistant biohazard transport bags. Option B, carry tubes loosely in a lab coat pocket. Option C, place requisitions inside the same pouch as uncapped tubes. Option D, store all specimens on a sunny windowsill until pickup. The correct answer is option A. Place specimens in approved leak-resistant biohazard transport bags. Approved transport bags reduce leakage and exposure risk during movement to the laboratory. Loose carrying, poor separation of paperwork, and sunlight exposure create safety and quality problems. Question 95. Which item is appropriate for warming a venipuncture site? Option A. A microwave-heated wet towel without temperature check. Option B. A facility-approved warm compress. Option C. Very hot water applied directly to skin. Option D. An open flame held near the arm. The correct answer is option B. A facility-approved warm compress. Approved warm compresses can improve circulation while reducing burn risk. Uncontrolled heat sources, open flames, and very hot water can injure the patient. Question 96. Which test is most affected by underfilling a light blue top tube? Option A, blood culture gram stain. Option B, serum cholesterol. Option C, prothrombin time. Option D, complete blood count. The correct answer is option C, prothrombin time. Coagulation testing requires an accurate citrate-to-blood ratio, so underfilling can alter clotting results. CBC, blood culture, and serum cholesterol specimens have different collection requirements and are not affected by the same citrate ratio issue. Question 97. Which patient statement suggests the phlebotomist should check for latex allergy precautions? Option A. I am nervous around needles. Option B. I drank water before my test. Option C. I prefer my blood drawn from the left arm. Option D. Latex gloves make my skin swell and itch. The correct answer is option D. Latex gloves make my skin swell and itch. A history of swelling and itching from latex suggests possible allergy and requires latex-safe supplies according to policy. Arm preference, hydration, and needle anxiety are important but do not specifically indicate latex sensitivity. Question 98. Which additive is found in a lavender top tube used for many hematology tests? Option A, EDTA. Option B, sodium citrate. Option C, lithium heparin. Option D, sodium fluoride. The correct answer is option A, EDTA. EDTA preserves cellular morphology and is commonly used for hematology testing such as complete blood counts. Citrate is used mainly for coagulation, heparin is often used for plasma chemistry, and fluoride helps preserve glucose. Question 99. On a certification-style scenario, which action is appropriate when a tube loses vacuum before filling adequately? Option A, push the stopper farther into the tube. Option B, use a new tube of the correct type. Option C, pour blood from another tube into it. Option D, squeeze the patient's arm repeatedly until it fills. The correct answer is option B, use a new tube of the correct type. A tube with inadequate vacuum may not fill to the proper volume and should be replaced. Manipulating the stopper, excessive pumping, or transferring blood between tubes can compromise specimen quality and safety. Question 100. Why is the first drop of capillary blood often wiped away for many tests? Option A. It contains only plasma and no cells. Option B. It prevents the need to identify the patient. Option C. It may contain tissue fluid that can dilute the specimen. Option D. It is always sterile and unusable. The correct answer is option C. It may contain tissue fluid that can dilute the specimen. The first drop can be contaminated with tissue fluid or debris, so many procedures require wiping it away. It is not considered automatically sterile, it does contain blood cells, and patient identification is still required.